This is our presentation on needle and surgical cricothyrotomy. Needle and surgical cricothyrotomies are the last step in the difficult airway algorithm. As a result, they are infrequent procedures, but providers should be aware of how to perform these procedures in an emergent situation where all other attempts to ventilate and intubate a patient have failed.
Indications for a cricothyrotomy include a failed airway, traumatic injuries to the face, head, or neck that do not allow for intubation through the nose or mouth, and the need for immediate relief of upper airway obstruction. There are no absolute contraindications for this procedure. Here you will find a list of supplies used when performing a surgical or needle cricothyrotomy. Some of these include a scalpel, trach, and guide wire for the surgical cricothyrotomy, with optional items such as a bougie and 10 milliliter syringe. A 14 gauge needle catheter, 3.0 ET tube, and jet ventilation capabilities are needed for the needle cricothyrotomy. Feel free to pause the video and review these items for further information.
In order to establish a viable airway, the cricothyrotomy must be placed appropriately. The cricothyroid membrane is where the needle or surgical puncture occurs and is located between the thyroid and cricoid cartilages. Clinicians should palpate for these structures in order to determine proper placement.
Next, we will discuss the two types of techniques related to cricothyrotomy, both needle and surgical. With the needle cricothyrotomy, it is unique because you insert a large gauge needle into the cricothyroid membrane and then correct the angle to allow the catheter to insert. Once that catheter is inserted, we will place the end of a 3.0 endotracheal tube at the end of the catheter and attach the ambu bag to oxygenate, or we will attach the jet ventilator circuit to help breathe for the patient.
The surgical cricothyrotomy technique is more invasive than needle cricothyrotomy. The big difference between these two approaches is the placement of an advanced airway, such as an endotracheal tube or tracheostomy tube, which is fed over a guide wire that sits in the trachea. As mentioned previously, this procedure will require more supplies.
There are a few important considerations when performing a cricothyrotomy in pediatric patients. The needle technique is preferred over surgical for patients up to ages 10 to 12 years old. This is due to the smaller airway seen in pediatrics and the decreased risk for damage to the surrounding structures. One should also consider that a needle cricothyrotomy only allows oxygenation for up to 45 minutes, so a more definitive airway should be established during this time. Here are our references. Thank you for watching our video.